Okay, we're ready to go. Hi, my name is Paul Kidston. I'm the Executive Director for the Canadian Foundation for Pharmacy, and welcome to the Wellspring Leadership Awards, the virtual reception for 2022. Today, we've got an action-packed event. But first of all, before I get started, I just wanted to let folks know what the Canadian Foundation for Pharmacy does. So, the Canadian Foundation for Pharmacy is a nationally registered Canadian charity. And of course, we're the host of the Wellspring Leadership Awards in this particular event. We support community pharmacists across the country in the types of programs that we do are things like the Wellspring Leadership Grants, which we're here to celebrate 3 recipients today. We also support innovation research grants across the country, and we had 4 recipients receive those this year with over $111,000 worth of research grants provided to those recipients. And we do the Pillar of Pharmacy Award. And this year we celebrated Rita Wynn. Just back on November 7th. So we believe that community pharmacists play a vital role in Canada's ever-changing healthcare system by financially supporting pharmacy innovation research, leadership education, and recognizing the leaders who make it happen. We play an important role in improving patient care in Canada. So we connect sponsors and donors with great pharmacy leaders who are on the forefront of innovation. And these are some of our great sponsors for this particular event. So big thanks to them. Today's Wellspring Leadership Awards is an example of the difference that sponsors and donors make to the Canadian Foundation for Pharmacy. So thank you to all of our donors and all of our sponsors. These are our award winners today, and we'll have an opportunity to hear from all of them today. I won't do any introductions. That's happening in a few minutes. Our award committee members. So perhaps I can ask Iris Kreutzwiser to make some introductions. She's our committee chair.
Thank you, Paul. Good afternoon, everyone. My name is Iris Kreutzwiser. I am a consulting and clinical pharmacist here in Hamilton, Ontario. I'm a CFP board member. I'm a member of the executive. I hold the position of secretary treasurer, but most importantly, I'm chair of the awards committee for CFP. In addition to adjudicating the submissions for the innovation grants, CFP also awards the Wellspring Pharmacy Leadership Award annually. It is my great pleasure to introduce our Wellspring Award Committee. So you see the photos before you. We have Jane Farnham, who's from Ontario, Rita Wynn from Ontario, Sandra Aylward from Nova Scotia, and Erin McKenzie from Prince Edward Island. So look carefully. Each one of these pharmacists are highly recognized and respected and tremendous pharmacy leaders in Canada. All are distinguished award winners from multiple organizations in their own right. But I will also reiterate what Paul said in his introduction, that Rita Wynn was the most recent recipient of the CFP Pillar of Pharmacy Award, which is highly recognized and coveted across Canada. Since the inception of the Wellspring Pharmacy Leadership Award, these 4 pharmacy leaders have given their time and expertise in adjudicating the submissions and honoring the late Barb Wells, who the award is named after. I've been a part of this committee since 2017, and unfortunately this year I was not able to participate, so I am very excited to hear from the award winners today. So on behalf of CFP, Erin, Sandra, Rita, and Jane, thank you for your dedication to the late Barb Wells, to this Wellspring Award, and to CFP.
Okay. Just 1 second now. There we go. That's got, thank you very much, Iris. And so without further ado, we will we'll start our session off here with Sandra. So Sandra.
Great, thanks, Paul. It's my pleasure to introduce Nicola Gale today. Nicola's from Calgary, Alberta. She graduated from the University of Alberta with a Bachelor of Science in Biochemistry in 2013 and a Bachelor of Science in Pharmacy in 2017. She's currently enrolled at the University of Victoria, where she's a candidate in the Master of Public Health program. Nicola received additional prescribing authorization, or APA, from the Alberta College of Pharmacists in 2018. And she was the recipient of a U of A Faculty of Pharmacy Preceptor Recognition Award in 2020. And that award focused on preceptors modeling exceptional patient-centered care. Nicola has worked since 2021 as a clinical pharmacist with the CUPS Liver Clinic in Calgary. The clinic provides screening, testing, consultation, and healthcare providers, disease monitoring and treatment, vaccination and education for people dealing with hepatitis C or other bloodborne pathogens. And among Nicola's goal is to help develop a model of collaborative care to increase access to testing and treatment for people living with homelessness. Nicola also works as a clinical pharmacist and program lead at the Calgary Drop-In Center, providing medication support and pharmacy services within a shelter. The Wellspring Award will help Nicola learn from global leaders in the field, especially where pharmacist-led models have led to the elimination of hepatitis C virus in their communities. She hopes to provide leadership to achieve these goals in Calgary. In a letter of support from an infectious disease specialist colleague at the CUPS Liver Clinic, the committee heard that Nicola has been tasked with establishing partnerships with external agencies to reach the hardly reached and to connect people who have historically been disengaged from care. Please join in welcoming and congratulating a 2022 Wellspring Pharmacy Leadership Award recipient, Nicola Gale.
Thank you so much, Sandra. That was a great introduction. Let me just pull up my screen share here. Does someone just want to give a thumbs up that you can see that? Okay, perfect. So yeah, I feel like I don't need to give much more information, but I'm very, very grateful to work for an organization called CUPS. CUPS is a low barrier accessible clinic in downtown Calgary. It's really wonderful working on such a team like this, where you can connect people with the services that they need without having to, book an appointment or send them across the city. So there's really diverse resources here that I think it's really speaks to kind of the approach that CUPS takes to providing holistic care, and not just focusing on dealing with things after the fact, but also focusing on prevention. So in the context of hepatitis C, it's so wonderful to have access to other teams that provide, palliative care and opioid agonist therapy, women's health clinic, really neat organization to work for. So within that team is the CUPS Liver Clinic. And my role within the Liver Clinic is really trying to bring Hep C care outside the walls of the clinic to the broader community. So like Sandra mentioned, a lot of that is building partnerships, developing things like outreach clinic days and screening days, training other community providers, including pharmacists, to be able to screen, test, treat individuals in the community for chronic hepatitis C virus infections. Also just want to say a huge thank you to the Wellspring Award Committee for providing me with some funding to do two things. I was able to go to the INSU conference in Glasgow, Scotland a couple of months ago in October. So this helped to pay for some of the conference fees associated with that. And also for funding to develop this post-conference community of practice event that we held a couple of weeks ago. I'm going to chat about these two things, and I think developing things like community of practice was just so wonderful, especially after the pandemic and not being able to do things in person, and is really integral to building that sense of community and collaboration that's really necessary for reaching hepatitis C elimination in Calgary and worldwide. So I just wanted to start by just explaining what INSU is, because I think that will kind of speak to kind of what this conference was about. So INSU is an international organization that started in 2009 that was really focused on supporting clinical tools and training people to be able to test, treat, and cure hepatitis C infections. However, in 2021, they changed the name to include health within their name. So the International Network on Health and Hepatitis in Substance Users. So this conference was really, really interesting. It was my first international conference that I'd ever been to, but it really brought together a really interesting group of people. So we weren't just focused on hepatitis C, but really the overall health of substance users. So lots of interesting conversations about substance use and advances and setbacks in opioid agonist therapy, criminalization of drugs, lots of peers present, people and living experience of substance use, hepatitis C virus infections, conversations about other STBBIs like HIV and syphilis, things like harm reduction, reducing stigma, and just the larger societal issues like homelessness and access to services. So these are some clips from the conference. Lots of long days in conference rooms, but so many learnings and interesting things to hear about from all over the world. And I really think this clip that I took in the middle really speaks to kind of the overall conversation that came up in the conference, which is asking the question of, instead of talking about hard to reach patients, what if we flip that around and talk about hard to reach doctors or hard to reach services or services with dumb barriers or restrictions on access? And I think that's a really key learning, is that, the systems that are set up don't necessarily provide the care that's needed by a lot of people. So instead of kind of punishing people for not coming to us, asking ourselves, why aren't we reaching the people that we want to reach? So really interesting learnings from all over the world. Got to do a few fun things on the weekends as well. Had way too much seafood, more seafood than I've ever had in my entire life. And you can see myself and Dr. McPhail on the top right, sitting in the conference room. And we got to meet and network with really, diverse people from all over the world, healthcare providers and peers and, social workers. And down in the bottom right, we also got to work with a couple of, like a pharmacist and a physician from the downtown east side. And it's so interesting seeing what other healthcare systems and what other countries look like in terms of healthcare delivery, and kind of reflecting on how that kind of plays out in Canada in terms of how our systems are structured. So some key takeaways for myself and Dr. McPhail that I was working with as well. So overall, there's this really strong emphasis on low barrier, integrated, decentralized care. So providing training for people to offer Hep C treatment in hospitals and pharmacies and shelters, and the importance of interprofessional care in particular, and utilizing the scope of non-specialists. So pharmacists were really emphasized, and we could see examples from all over the world where pharmacists were being utilized to their full scope and integrated within these teams to, offer testing and counseling and prescribing, and then monitoring the client over the course of their therapy. Really wonderful examples of course, nurses and nurse practitioners and peers. But I, as a pharmacist, I'm a little bit biased, but so many wonderful examples of, in Australia and New Zealand and in Scotland of pharmacists being incorporated into these, this model of care delivery. Lots of really unique service delivery options too, people going out on bicycles with their testing kits, combi vans in Australia, this concept of prescribing cell phones, which is a program out of BC CDC called the TestLink Call Project. Lots of interesting advances in testing, like point of care tests that can be offered in pharmacies and self-testing. And then kind of zooming out and looking at these bigger picture problems like criminalization and tainted drug supply that exists in Canada, and some of the structural barriers to achieving just health equity in terms of hepatitis C and people's broader health. So accessible care, addiction care, housing. I also gave a presentation on the 21st, just about this network that we developed in Calgary and some of the ways that we're bringing Hep C care to the wider community. So just to give a really quick snapshot, a couple of the projects that I've worked on over the past year was creating this partnership with the Addiction Recovery and Community Health Team, or ARCH, which is a hospital specialty consult service, where we would start Hep C treatments for people while they're hospitalized, and then CUPS, so myself and a peer worker would follow their transition back into the community. Have done some clinic outreach and screening days with places like Permanent Supportive Housing and the Drug Treatment Court System in Calgary, and then a pharmacist-based Hep C screening program within a shelter. So just to zoom in on this particular pathway, this was one that I developed while I was still working within the shelter. So trained frontline nurses and staff to be able to provide hepatitis C point of care testing. And then any clients who came up positive would be referred to myself, and I would collaborate with the liver clinic virtually through their EMR system to, do the workup. I can order blood work, I can prescribe the treatment, and then follow them over the course of their Hep C treatment, all within the shelter. So the key piece of this is that clients never had to leave the shelter to access care, or any piece of that care. So they could get testing, they could do the blood work, we could have the conversations and the counseling all within the shelter. We know that there's so many barriers for people experiencing homelessness to access care within traditional healthcare settings and clinics, getting to appointments, having a cell phone in the first place to make the call and make the appointment. So that's just one example of one of the care pathways we've developed. The next piece that I found so rewarding is that we went and had a preceptorship with Dr. John Dillon in Dundee, Scotland. So the reason we wanted to do this is because Dundee and the Tayside Health region is the only area in the world that's actually already reached Hep C elimination. And the way that they did this is by building these collaborative partnerships with a whole bunch of community settings, and pharmacy was a really integral partner in this. So they've done incredible work, have already reached this goal of Hep C elimination before anyone else in the world. And so we kind of wanted to see it firsthand. So we did some pharmacy tours, we met with other pharmacists, learned about just what pharmacy looks like in their setting. Is this something that can be replicated in Canada? So just to kind of give a snapshot of what their care pathways look like. So they train people in all of these settings, so prisons and needle exchange programs, drug treatment centers, and of course pharmacies, to be able to offer testing and then treatment specifically within those sites. So really interesting to see some of the follow-up results from these care pathways, and just showing that within pharmacies, they had some of the highest treatment completion rates and the lowest loss to follow-up. Of course, we need all of these settings to capture and connect with all the people that we want to connect with, but was just so cool to see how pharmacies were being utilized within this care pathway and just how successful it is. So some of the takeaways from the preceptorship were just the importance of that partnership. So this is something that they developed over 10 years, and they used research and evidence to progressively build on this service delivery model. And that collaboration with pharmacies and peer organizations was so integral to that. One thing that was just absolutely bonkers that, our jaws were on the floor when we asked this question of, how many of your clients are experiencing homelessness? And they said none. Like they had one person who was living with homelessness that was about to get connected to housing, and we were absolutely shocked. And I think that just speaks to kind of the breadth of the problem in Canada. And, I think it's a little bit normalized at this point, like just how widespread homelessness is in Canada. And it really affects, things like this, like being able to connect people with care. So we really need to be able to provide services to people. They also have really robust social services, 100% coverage of medications. They have pharmacare, and everyone has a family doctor. So obviously we can't just transplant one program to another country. So there's these really key differences between us. But I think there's really important takeaways that we can bring to Canada. So we have signed on to become, to reach this World Health Organization goal of reaching hepatitis C elimination by the year 2030. And there's organizations that are tracking our progress at a national and provincial level. So we don't have, this national or provincial sign on to reaching these targets like they did in Scotland, but it is within our reach. And these organizations have identified pharmacies as key partners in helping to reach this goal. So utilizing non-specialists and the scope of practice of pharmacists and other healthcare professionals to be able to help reach Hep C elimination. We know that there are specific groups as well that experience inequitable access to healthcare in general. And of course, these groups are also overrepresented and carry the largest burden of Hep C within Canada. So taking all of these learnings, knowing that collaboration and this interprofessional care is so integral to reaching elimination and expanding Hep C care, we wanted to develop some community of practice events in Calgary. So we did this a couple of weeks ago on the 23rd and the 30th. So we brought together, again, a really interesting kind of group of people. We weren't totally sure who was going to come, but we had some case discussions and we introduced some of the Hep C programs in Calgary, group brainstorming and discussions around Hep C care. We all talked about some barriers and opportunities. It was a really interesting opportunity just to network with other organizations in Calgary that are already connected and have those partnerships and those relationships with the folks that we want to be reaching with our programs. So I know this picture makes it look like we kind of just got together and did some homework together. I forgot to take pictures during the action sections of the evenings, but really great discussions. There was peers present, people with lived and living experiences, nurses, pharmacists, physicians, social workers. There's even like a documentary filmmaker there from one of the other Hep C programs. And a really diverse group of organizations from Indigenous Health Services to Safe Consumption Site, Shelter Health Services, STI Clinic, etc. So just overall thoughts, I think pharmacists have a unique opportunity here to improve patient care for one and meet this unmet need in our communities. Knowing just the scope of the problem of homelessness in Canada, sometimes pharmacists are the only healthcare that a lot of people are connecting to. Many folks don't have a family doctor, and we can be that connecting point to other services that can meet their needs. Whoops, my timer went on. Sorry. We can demonstrate our scope of practice. You know, here in Calgary, I'm able to prescribe, I can order blood work. I can basically do from start to finish the whole Hep C cascade of care. We can show our strong connection with community that already exists, and in particular, these quote unquote hard to reach groups. We have a role to play within interdisciplinary teams, and of course, we can support these overall public health goals that we have in Canada and the world. So thank you so much again. Really glad to be able to share some of my experiences, and of course, so grateful for the opportunity to have these experiences and to share with you now. So that's all.
Great. Thank you so much, Nicola. That was really interesting, and I'm excited to see the kind of output that comes from the work and the leadership that you're showing this critical area. And living here in Peterborough, Ontario, we have a homeless crisis actually going on, and so it's interesting to see that other countries have found a way to figure it out, because we certainly need to do that here in Ontario as well. So thank you so much. Now it's my pleasure to introduce to you Denise Kreutzwiser. Denise is the pharmacist at the St. Joseph's Healthcare Centre in London's pain management program. With this grant, Denise is going to create a pharmacy residency program focused on pain and mental health. I think there's a theme here today. Developing a residency program means looking beyond the clinical world and requires leadership skills to successfully implement. She will design a residency curriculum that will prepare pharmacists for the fast-paced, technologically driven world of healthcare that we live in today. The objective is for her to learn how best to train residents to accept and manage the clinical uncertainty inherent in daily practice. Her goal is to develop a successful and sustainable pharmacy residency program that will graduate well-rounded and high-performing pharmacists. There is a critical need for more residency programs in Ontario and in Canada in this area. To better equip her in creating an impactful and sustainable program, she will be using her Wellspring Award to fund 2 certificate courses through Maastricht University in the Netherlands, as well as to visit a couple of residency programs in the United States. She will also attend the American Society of Health Systems Pharmacists National Pharmacy Preceptors Conference in the fall of 2023. That's a very, very detailed, specific conference, the only North American conference focused on education and training for pharmacy residency preceptors and residency directors. The committee felt that this program embodied everything that was so important to Barb, the actual original intent of this award, developing leaders in pharmacy that would help guide the next generation impact practice, and not only develop themselves as leaders, but to use that leadership to foster this in others, and in other words, to pay it forward. I'm excited to see what the new residency program will look like. Please welcome Denise.
Thank you, Rita. I'm just going to share my slides here. You should be able to see them now.
Yep.
Wonderful. So today I'm going to tell you a story. And you've probably heard the saying, the journey of 1,000 miles begins with one step. So for this story, I'm going to begin like most stories do begin, once upon a time. So I was a farm kid and I did farm chores. I essentially grew up with the concept of work-based learning. So after a bunch of steps, I eventually became the pain management program pharmacist at St. Joseph's Hospital in London, Ontario, as part of the St. Joseph's Healthcare London organization. So this is a large tertiary care, university-affiliated hospital. Now, before I tell you more, I'd like to highlight 3 instrumental steps on my journey that are going to set the stage for why I'm speaking with you today. So the first step pertains to how I was a member of the University of Waterloo's Vanguard Pharmacy class. Now, as my Vanguard classmates can attest to, there was something special about our class. We were the first in the country to undertake a co-op pharmacy education program. And while this co-op education reinforced the value of hands-on learning and it stimulated workplace readiness, being a Vanguard student also meant we were in this ever-changing PDSA cycle. We embodied the words adaptable and innovative, and our entire curriculum was really an exercise in continuous quality improvement. As Vanguards, we persevered and we learned to embrace uncertainty. So the next 2 steps are actually connected. So step 2 and 3 are really representing my time in residency training. So I did a year 1 General Hospital Pharmacy residency at London Health Sciences Centre. And then I went on and did, after a few years of working as a pharmacist, a year 2 pharmacy specialty residency in HIV and viral hepatitis. And this was at the Toronto General Hospital and McGill University Health Centre in Montreal. This residency training really provided me with the opportunity to practice at a higher critical thinking and problem solving level, and ultimately to deliver better patient-focused and quality care. So it was the skills I gained from the residency training that have really set the foundation for where I've ended up. And as Rita had said, I'd really like to pay this forward. So on March 8th of 2022, I had my performance review. And as many people can probably relate, their organization supports performance reviews every couple of years. And at the end of the review, you usually develop a professional development plan. And so I said, I would like to create a pharmacy residency program at our organization. And I would like for it to be anchored at the pain clinic, really intertwined with mental health and rehabilitation services, because these are key things that our organization focuses on. And so at that point, my pharmacy director said to me, well, that's an ambitious professional development plan. Are you sure about this? And I said, yes. Here's my rationale for why we need this. So there's applicants to the Canadian Pharmacy Residency Program, and this is a very competitive program. Almost 300 applicants went unmatched with the 2021 to 2022 residency year. There were 116 successful applicants for the year 1 programs. Of the pharmacy residency programs that currently exist, there's only 3 that are ambulatory pharmacy programs, and none of these residency programs offered more than 4 weeks of pain management training. Advanced pain management pharmacists are rare, and there's currently few opportunities for this in Canada. There are some more in the United States. Ambulatory care is really the future. By training pharmacists to take leading roles in the ambulatory care setting, and in particular pain and mental health focused areas, we will be better able or better positioned to care for the baby boomer population in the coming years, and hopefully to help keep patients out of hospital and better able to live a full and meaningful life in the comfort of their homes for longer. So with that, the director of pharmacy at the organization I work at said, okay, what kind of supports do you need to do this? And it was at that point in time that I reflected a little bit further, and I reached out to some pharmacy residency coordinators at other Ontario organizations, and I talked to the very first pain medicine residency program director here in London, and I said, what was it that you would have liked to have known before you started your residency director or coordinator positions, and what suggestions do you have for me to create a residency program and look into supports for doing this? And a thread across all of these discussions with my colleagues was learn something about pharmacy leadership and healthcare systems organization in order to better prepare yourself to navigate the development of the residency program. You should also look into some more work-based learning education strategies so that you can best cater to what the resident will need. And so with that said, I then stumbled across the Wellspring Pharmacy Leadership Award, and the timing was serendipitous, like it could not have been better. And so we applied for this award with 3 specific aspects in mind. The first activity, as Rita had alluded to, was completing 2 certificate courses. And this is from the Maastricht University School of Health Professions Education in the Netherlands. And so I had spoken to a few pharmacists who'd actually took courses from this university, and it's a very globally known university for health professions education. And so these 2 courses, the first one being the certificate course in curriculum and instruction, and the second course being a certificate course in organization and leadership, really provided a description for skills that I was going to need to learn. And I've actually, spoiler alert, been taking the curriculum and instruction course for the past 7 weeks, and it is phenomenal. I'm learning so many things, and I'll be taking the organization and leadership one in the new year. So these courses are each 9 weeks long, and they have 18 hours of coursework per week. So the second activity was looking at other established pharmacy residency programs that would have similar offerings or designs as to what I was envisioning. There wasn't a program like this in Canada, but there are a few in the United States that have intertwined these elements. Some of them are year 2 residency programs, but the overall concept of how they're delivering them was felt to be very, very applicable. And it was highly recommended by the other pharmacy residency coordinators that I spoke with, that you lean on other residency programs to see what works for them, what the hurdles were that they had to overcome in order to deliver their residency programs, and what successes they had that you could maybe mimic. The third activity is related to attending the American Society of Health Systems Pharmacists National Pharmacy Preceptors Conference. So this is the only pharmacy residency focused preceptor conference in North America. And the rationale for wanting to go to this conference is really that another need I identified was that we have excellent pharmacists at our organization, but becoming a preceptor to a resident, especially if you have not done a residency yourself, can be a very intimidating sort of situation. And so I wanted to learn the skills and what I needed to do to mentor new pharmacists to become preceptors of the residents and have us be able to really expand on the program as we go through it. And so I found out on June 30th that I was a recipient of this Wellspring Pharmacy Leadership Award, and it was very exciting news. So the very afternoon that we found this out, I said to our pharmacy director, you know what, we've got access to the supports we're going to need. Let's just go, you know, full in, and let's do the residency program that we can have a resident start with the September 2023 group. We had 4 weeks to get our application into the Canadian Society of Canadian Society of Pharmacists for the residency program. And so we did indeed pull this off. We had the applications for the residents or potential residents go live on August 8th, and they closed on October 14th of this year. We had a virtual open house in late September to talk all about our residency program and how it's very unique compared to many other residency programs. We did interviews for our candidates in November. We just wrapped that up. And the pharmacy matches, which are a Canada-wide program, will happen in January of 2023 with our first resident to start in September of 2023. So we are well on our way. And what our residency program is going to look like is we've got 8 sort of core rotation elements. Some of them are very standard. There's a orientation, evidence-based medicine. There will be some distribution elements where they'll learn about the hospital outpatient pharmacy setting, as well as the inpatient pharmacy setting. And a lot of that has to do with the fact that, you know, sometimes we have day surgeries and how you kind of factor that element into the ambulatory care aspect of hospital practice. Pharmacy leadership will get a week teaching, and there'll be a research project for 8 weeks. And then we've got 29 weeks of core clinical rotations that the resident will be participating in. The pain management program is going to be the anchor for this residency, and that's where the resident will develop foundational skills. It'll be 3 months in total that they'll spend there. And then other core rotations will be our rheumatology center. We will have a mental health rotation that will be 5 weeks at our mental health site. Inpatient rehabilitation will be another rotation that is mandatory, but the resident will have an option to select between whether they're interested in stroke rehab or geriatric musculoskeletal rehabilitation, that sort of thing. And then palliative care will be the other core rotation. We'll have 8 weeks of elective rotations that the residents can choose from. So in terms of anticipated learnings from this initiative, really, while this award is taking my professional growth to the next level by enhancing my skill set, it's so much more than that. All the learners that we're going to be influencing and all the colleagues and co-workers that we're going to be collaborating with as we go through this, it's just going to multiply. And another thing is that, you know, we're not just expanding postgraduate training positions for pharmacy residencies, we're expanding this in pain management. And this really does align with the Canadian Pain Task Force recommendations on doing this. And from our pharmacy director's perspective, you know, this is also a pharmacist recruitment and retention strategy. From the pharmacist perspective at our organization, we anticipate that this will increase their job satisfaction levels, because they'll see that they're really training the next generation of pharmacists in an area that we specialize in. And then we are also going to be able to have the opportunity to collaborate with our physician pain medicine residents, as well as our psychology residents. So really, we're going to expand, and there's so many places that we can go. And so with this said, the journey does continue. And you know the phrase, you can't eat just one chip, and how 1 turns into 2 and then turns into 3 and then it turns into 4 before you know it. So, you know, if this residency program is like anything else that I seem to come across, I do anticipate that we are going to expand rather quickly. So with that said, I would really like to thank you for this very prestigious award and for facilitating all the supports that we need to make this residency program a success at St. Joseph's Healthcare in London.
Thank you so much, Denise, for sharing with us your story. And once again, congratulations. And I was certainly really struck by the fortitude that you've demonstrated from the outset, and I'm really thrilled that this award could potentially be a real catalyst for you getting this thing off the ground. And I really appreciated in the beginning of your remarks your desire to pay it forward. And I've been a participant on this committee since inception. I was a personal friend of Barb Wells, and you truly are embodying the spirit and the passion and the energy of Barb, and it's just really heartening to me to hear that. So thank you so much for showing up, and we'll be really excited to be following your progress as you launch this initiative. Thank you so much.
Thank you.
And now it is my pleasure to introduce Janice Yeung, and her project is the development of a pilot regional practicum model in the UBC Early to Practice program. She's a lecturer and director in the Office of Experiential Education at the UBC Faculty of Pharmacy. She has academic and administrative leadership responsibilities. And her project's really focused on taking entry to practice PharmD students to complete practicum experiences in rural and remote areas. We were struck immediately as a committee when we saw her opening salvo in her application, where she talked about healthcare access challenges for remote and rural communities due to the difficulty in recruiting and maintaining an adequate healthcare workforce. You could not be more timely, Janice, in the introduction and implementation of this project. Coming through the past almost 3 years now, we've seen how pharmacists have been able to step up and take on the role that those of us who've been in the profession for many years have dreamed that pharmacists would be taking on. And some of the outcomes that we're starting to see in the context of access to healthcare, frontline healthcare, is creating a much more compelling case than ever for pharmacists to be in the leadership role. And on a personal note, I grew up in a rural community, so I can very much identify with challenges to access. And this summer, I had the privilege of meeting a physician in a very rural and remote area of northern Maine who was drawn to practice in the area almost 50 years ago by a program such as yours for physicians, where he was enticed to practice in this rural community in northern Maine. 50 years later, he's there and has been of service to the community. So I think it really emphasizes that these types of programs really work. And we were really struck by some of the references you provided, where they really talk about your proactiveness in seeking personal leadership education. I'm very confident that your goals are going to have a significant impact on the profession, and more importantly, on the long-term health outcomes of Canadians. So I'd like to invite you to share with us more detail with respect to your program. And once again, congratulations.
Thank you so much, Jane, for that wonderful introduction. And I'm also from a small town. I grew up in northern Alberta, Fort McMurray, Alberta, and did spend some time working in Trail, BC too upon graduation. So I am really keen on having fellow students experience that rural type of practice that's so rewarding in so many ways. So let me just share my screen. Everyone. All right, so thank you so much. So today I just wanted to tell you a little bit about what I've been working on here at UBC. But before we begin, I'd like to start off by talking just a land acknowledgement to acknowledge that the land from which I'm presenting is the traditional, ancestral, unceded territory of the Musqueam people. So many of you are joining us today from other places near and far, and I would also like to acknowledge the traditional owners and caretakers of those lands. All right, and so just a little bit of background. So as Jane alluded to, recruitment and retention of healthcare practitioners in underserved areas is definitely a challenge. My team and I were actually just in Prince George in northern Alberta, northern BC, a handful of weeks ago, and just speaking with some of our external stakeholders, there's been challenges with recruiting and retaining pharmacists up in those areas. And health professional education and training can definitely play an important role in supporting the recruitment and retention of practitioners in these underserved areas. So just a little bit of background about the UBC program, Enter to Practice program. So students complete 42.5 weeks of experiential education over this 4-year program. So that works out to about 1,700 hours. Each practicum ranges from either generally 4 to 8 weeks in duration, with one that's just 2 weeks. What we hear from our students is that there's a lot of challenges associated with relocating for practicum. So many of them don't want to leave the Lower Mainland to experience practicums in areas outside of Vancouver, just simply because of the challenges with travel, with identifying and finding accommodations in those areas. There's also a huge transition for students as they're, moving and relocating to some of these rural communities and being able to adapt to those communities. And because of the short time frame of our practicums, our students do have challenges with building meaningful connections with the patients and the members of those communities because the time frame is so short. So what we were thinking about, well, what about a regional practicum model? And so what we were envisioning with this model is that students would complete a series of their practicum courses within a selected rural remote geographical region. So outside of the Lower Mainland, so thinking about northern BC, the interior BC, or Vancouver Island. And so we started thinking about this. So our office, we have about 224 students that enter into our program each year. So our office does about 1,500 placements each year. And so we really wanted to do a little bit of work to see what's been done before. So we've completed a literature review. We've done an environmental scan. And so there are other programs that do have sort of a similar type of model. So especially in medicine, medical programs have have implemented what are called longitudinal integrated clerkship models. And that's where medical students will complete a series of weeks of their training in one area with one patient population with one preceptor. However, there's been a lot of extensive literature about these models in medicine as well. They're just regarding the continuity of patient care, the benefits of the quality of participation in these types of practicum opportunities. Students really find that there's a lot of satisfaction in helping them develop the clinical competence that they need because they're working in the same area over a prolonged period of time. They're also developing a lot more clinical confidence and competence in what they're doing. However, in the literature, when we read the literature, there wasn't anything that we found related to pharmacy. And as well as in our environmental scan, none of the pharmacy programs across Canada or in Northern America seem to have such a model to date. We also did a student survey as well, and so we wanted to identify if students would even be interested in participating in such a model. And so we had about a quarter of students did say that they were interested in working in a rural remote area upon graduation, or that they were from that region. And we had about 32% interested in participating, with 45% possibly interested if we did have this model. So there was some interest there that hopefully once we develop the model, we can encourage students to participate. So what we've been doing so far is development. So doing a little bit about that background work, we are now in the development phase. And recently we have been building our study team. We've identified a rural remote community liaison to work with us. So a practicing pharmacist from northern BC, just to help provide input and guidance in the development of this model. We've also recently hired on a graduate academic assistant to assist us with this. And so in the new year, we're actually going to begin our community engagement to better understand how we need to develop this model and how we are going to develop a framework that is sustainable, we really need to speak with our community partners in these areas. And so in January, we are scheduled to head into the Southern Interior BC, and we have an invitation out for our community stakeholders, so practicing pharmacists in the area, to come and meet with us and just really to talk about their interest in participating, serving as preceptors within this model, and determining what kind of resources might be needed. In February, we'll be traveling to Vancouver Island again to hold a symposium there. And then hopefully sometime in the spring, we will be heading up to Northern BC to meet with stakeholders there. So once we've gathered all of this information from the communities and identified what might be needed to develop such a model, we will determine a pilot region. We will then start recruiting practice sites and practice educators or preceptors to participate, to precept our students during these rotations. And we'll need to develop some training and orientation materials to support student and practice educator or preceptor preparedness. So what we do is we hope to implement this pilot regional practicum model in the year 3 and year 4 of our entry to practice program. So in year 3 to year 4, when students finish their year 3, they've actually completed most of their didactic component of their program, and they'll go on to do 32 weeks of practicum opportunities over 4 courses. And so currently right now, students may be placed anywhere across the BC for these placements. Student might be doing one placement in Vancouver, and then the next month they're traveling up to Northern BC. The next month we might be going to the island, for example. And so there is a lot of transition associated with that. So with this regional practicum model, they would complete all 32 weeks within a defined geographic region. So during implementation, we'll have to define and develop a scheduling and placement process. We would have students self-identify if they'd like to participate in this pilot model, hopefully in the fall of next year. And then they would be placed in those practicums within a region, and those practicums would run from May 2024 to April 2025. So what we're hoping from this is that with the work that's being done, we will be able to develop and implement a sustainable regional practicum model for our program. And through this model, we hope that our students will be able to have some really unique practice experiences. So Jane, as you alluded to, practicing in the city kind of urban setting is very different than working in a rural setting. And as I mentioned, I had the opportunity to work in Trail, BC, a small town in the Kootenays when I graduated. And there's a lot of great learning from working in these smaller communities. We hope that this regional practicum model will also ease student transition and relocating. So by having students spend, a more significant amount of time in these areas, they'll get to know the community, start to create some connections, and understand really some of the value of working in these types of medically underserved areas and communities of BC. Overall, we hope that, it'll provide an overall better student learning and experience. And so if students are hopefully better adapting to the area and the practicum experiences that they're in, hopefully that translates to also better patient care. And in the end, we hope that this supports the recruitment of pharmacy graduates to these regions. So by having these learning opportunities during their training, we hope that, when they graduate, they'll consider these job opportunities that come about. Once we've ran the pilot, we do hope to evaluate and to see if we've been able to meet some of these desired outcomes that we've identified. And so that'll include completing an institutional ethics application. We're really going to want to assess, the overall student and practice educator experience for those that participate in this model. And then from there, identify what sort of refinements or changes we might need to make to the model. Because our hope is then to further expand the model from not just the one pilot region but other regions across BC, and increase the number of students that can also participate in this model. So we have had an opportunity to disseminate some of our earlier work as well. I think there's a lot of value, perhaps that other pharmacy schools or other pharmacy education programs might gain from such a model and from some of our experiences. So we've had a chance to present a poster locally here at UBC, and as well as at the most recent AFPC CPERC conference in Newfoundland. So that's the Association of Faculties of Pharmacy of Canada conference. Great. So that brings me to the end, and I'd like to again thank the review committee for this award. I think you know, the funding from the Wellspring Award will allow us to has allowed us to build our study development team, and is allowing us to travel to some of these areas to engage with our stakeholders that will really help inform the development and the implementation of this regional practicum model. All right. So with that, thank you so much.
That's great. Thank you, Janice. So I'll just, Iris, is there any thoughts or comments that you'd like to share with the group before we, oh, we just got you on mute. We have you on mute.
Thanks, Paul, and thank you to the award winners. Your work and research projects and the leadership that you are demonstrating are inspirational and much needed in the profession. And we thank you very much for your passion and energy that we all heard as well today. Thank you.
Very good. I'm just going to share one more screen before we wrap up. But I wanted again to thank our sponsors and our donors who make all of this happen, of course, and of course our board of directors at the Canadian Foundation for Pharmacy who support all of this and the tireless work that they do as well, and of course the committee who has done all the who's gone all through the review process and made this all happen today in terms of all these wonderful leadership initiatives. So I just wanted to thank the entire group for today's session, and I will let you know it is going to be recorded, and we will have it on our YouTube channel here very shortly. Okay. So so listen, thank you very much to the entire group. Thank you.